Assalamualaikum warahmatullahi wabarakatuh and very good day. Thank you for listening to this video. This video is created to explain about the field residential program implemented in Royal College of Medicine, Perak. The field residential program aims to provide students with hands-on experience and understanding of critical aspect of public health practice. They were given 8 weeks for public health posting, of which 2 weeks are allocated for field residential program potential areas in the district. Students normally will be divided into two groups and posted to the field program. It is necessary for them to be in the field to understand and experience the implementation of the program. What are expected activities? First, they have to develop the proposal and the plan of intervention. So based on the theory and basic principle of public health, students are guided to develop a proposal on the program. The arrangement will be made with the district medical officer of health and the authorities in the village before the program started. It follows with community diagnosis. Students will be expected to do the rapid rural appraisal of the assigned community, try to identify the problems and prioritize them. They have to conduct the community survey to identify the problems and then implement the health campaigns, followed by the FRP report. They were expected to present their findings in the debriefing session. Each group will be develop their organizational structure to designate the responsibility for each members of the group. There will be a leader as a station manager, group leaders to do community diagnosis, health campaign, and also the survey. In community diagnosis, students are required to go through the whole process of community diagnosis. That is the process of appraising the health status of this assigned community. That include identify the determinants of health, such as socioeconomic condition, prevalence of disease, and risk factors. And they are required to use a combination of various rapid rural appraisal methods to arrive at the community diagnosis of the health problems assigned in the assigned village. And to come to this community diagnosis, students are expected to gather the information from secondary data sources, such as from national, state, district level, and nearest local health centers on the health of the community and socio-economic and health-related information. They also have to do a visit to local health facilities and interviews with the local health personnel. They will also doing the tagging and mapping of the village. That include mapping the resident houses, roads, and community centers. Also, they have to do the talking to residents and do the direct observation of their premise environment. They will take the local history of village from the key informants and also conduct the focus group discussion, group interviews, and to get the perceived health status, social health problem in the community. And they will compile all this information on social health problems, list of health issues and problems. Later on, they will brainstorm and prioritize the health problem using the nominal group technique. In nominal group techniques, all the issues and problems will be listed in this table, and each members of the group will do the ranking on these problems. The highest rank will be selected as the issues or problem that need to be tackled using the health promotion campaign. Before they plan for a health promotion campaign, they will plan and conduct the community survey on these selected problems. Using these results of this survey, they will come up with a theme of the health campaign, entrepreneurship ideas. Of these students are expected to get some of the relevant data about the district or district health office. They will get this data from Office of Health or from the staff and the district health office. Some of the relevant data include total number of patients attending this clinic, and also some of the data on the number of communicable diseases in the district, and also the immunization coverage and so on. It is very important that the student acquire some of the important data to be able to make a diagnosis of the issues and problems in the district, such as communicable disease and non-communicable disease. In terms of communicable disease, number of tuberculosis cases, number of food poisoning, and many other communicable disease will be, and it's also important to get the non-communicable disease, such as hypertension, diabetes cases in the district. In the community diagnosis, students are expected to interview some of the key informants in the district, such as the elders, the head of the village, and maybe some of the authorities in the village. Students are expected to get the map of the area so that they will locate the positions of the healthcare facilities, roads, vegetations, properties, activities in this area. At the same time, students also are expected to observe the environment in this village. Example, looking for the solid waste disposal, looking at the environments such as the dust, and also probably looking at the nuisance and probably animal disturbance. They also should observe the drainage system and the sanitation in this area. At the same time, they also have to look at the problems among the people, the attitude as well as the practice among the adolescent, elders, and so on. Students are expected to do the meetings as well as the focus group discussion. In focus group discussion, students are expected to get more information, in-depth information regarding the issues in this area. They will discuss in detail on some of the issues that found earlier, either from the key informant interview or from observations. Focus group discussion probably involve certain groups such as mothers or some of the people who are affected by the issues and the problem in the district, in the village. Students also are expected to list down all the issues, discuss that in the group, and prioritize the issues. We would like them to use the nominal group technique, to prioritize and to select the issues. By ranking all the issues, students will be able to look for the issues that affected most of the people in this village, as well as issues that they will be able to do the interventions. This will follow with survey on the selected issues. Students are expected to develop a proposal on the survey as well as conducting the data collection in the community and come up with a report. From this survey, students will be able to focus on certain issues that they will be able to intervene. Campaign will be understand and to apply the knowledge gained and develop skill required for planning, public communication, budgeting, handling meetings, and public speaking. We also expected to apply the theories and methods of health promotion and education in the community. We also will develop skills and confidence in working with other agencies and have partners in the community and in dealing with various type of people, and embed the elements of social entrepreneurship into planning and implementation of the health campaign. In health campaign, they will divide into preparatory phase and also the launching phase. In preparatory phase, they will determine the purpose of campaign, formulating the topics, following the conclusion from the community survey. Then they will develop the intervention proposal. The proposal will be vetted by the lecturers and also by the community in the village. They also will come up with a plan of evaluation. They will seek the collaboration if necessary. That will include the district health office staff, any NGOs, and health agencies within the district. In the planning for the health campaigns, they will decide on the topics, on the time and the place. They will do in the community centers and also propose the activities such as health exhibition, health talks, forum, dialogue, or gotong royong, health quiz, coloring contest, health screening. Also come up with the budget. They also plan for the opening and closing ceremony. They will prepare the launching that will include the promotion materials, backdrops, banner, invitation card, program book, and so on. Sometimes they also come up with a gimmick material, and they will also prepare interventions such as health screening and also for the evaluations. After the implementation of this campaign, all the data collected will be analyzed and presented to the through the report. Some of the intervention that students can do in the community will be the health campaign. These examples are the banner used for the campaign, and within the campaign, the activities that they can propose include the health examination, health educations, forum. Sample they can also demonstrate all the activities like aerobic and Zumba dance. They can also have the competition for the children and so on. To support the activity, the campaign, students normally have some additional activities with the people that include the competition such as friendly match, badminton friendly match between the student and the youth in the village. And during Ramadan, for example, students also may be involved in making the bubur lambok, and students are expected to prepare the site for this intervention. That will include the identification of the site, cleaning, as well as gotong royong. On the day of the campaign, students are expected to organize the opening ceremony. Normally, the local leaders in the area will be called to officiate and to support the campaign. To the registration, some activities like an aerobic dance, health screening, health demonstrations, and health exhibition can be conducted. Students can also conduct the competition among the children, either at school or even during the health campaign. The involvement of school children in the health campaign is very crucial because they are the future. Intervention also will include talk by lecturers or by invited guests. They will deliver the health message to the people. The results of the survey will be presented to the community and we will discuss people attending the campaign. The health campaign also include the social entrepreneurship project. So students expected to come up with ideas and prototype on some project that will help the community to practice or to develop on their own or to give advice on some of the plan that will be able to help them to increase their quality of life. This one is an example of student developing the Facebook for the community, and the other project sample to come up with the natural product in their community and to give advice on the proper equipments for the disabled people in the house. Students are expected to come up with the evaluation to show their achievements in terms of resident participation and so on. Program report should have to include the acknowledgement, table of content, groups, organizational structure, and diary of event. The main text should include background of the district, community diagnosis, community survey results, and also campaign. They also have to include the entrepreneurship project. With that, ladies and gentlemen, thank you very much for your attention.